All right, unfortunately, most men don't need much of an excuse to avoid seeing their doctor. Now, in a COVID world, that unhealthy practice has only intensified. So today, my guest wants you to wake up to the realities of prostate cancer, while also showing you a revolutionary new way to treat it. And Dr. Douglas Widman is the medical director and radiation oncologist for Columbus Cyberknife. Thanks for being with me today, doctor.
Thanks again for having us.
All right, Dr. Widman, I want to start off with the basics of prostate cancer. What are some of the risk factors that may increase a man's chance of being diagnosed with that in the first place?
There's several risk factors. Probably the first one is age. More common to see prostate cancer in men who are 50 and over. Some of prostate cancer runs in families, so there may be a genetic component. Still trying to learn more about that. And race, African American men are at higher risk for prostate cancer.
So men then need to be aware of the signs and symptoms. Talk about some of the most prominent things then that show themselves when it comes to prostate cancer.
Yeah, the overwhelming majority of patients that we talk with come in without having any symptoms. They were diagnosed usually because their PSA blood test was checked when they went in for their annual physical examination. So that, it's screening for early prostate cancer using blood work. Most of our guys are asymptomatic. If they get to the point where they're having symptoms, like urinary symptoms, then that's worrisome because that suggests that it's a more advanced stage.
And even sometimes I know, that it does present itself, pain in the hips or back, right? Things that they may attribute to something else. Is that often the case?
It certainly can. And again, that's a bad situation usually if it's already metastasized. If it's spread, it likes to get into the skeleton. And so patients can, unfortunately, sometimes present with bone pain virtually anywhere.
And Dr. Widman, how common exactly is prostate cancer?
It's the second most common cancer among men. I think I saw that the American Cancer Society said there's going to be over 7,000 new prostate cancer diagnoses in 2020 here in the state of Ohio.
All right, so that brings us to Cyberknife, a robotic radiosurgery. Tell us exactly how this works.
The nice thing about Cyberknife is that we're able to deliver radiation in a way where we can speed it up. The problem with radiation therapy, I've been doing this for long enough to have lived through many years where I had to tell patients, hey, to do radiation therapy, this is going to take 8-9 weeks of your time. With Cyberknife, we're able to condense the radiation therapy all the way down into just 5 treatments. And the way we're able to do that is because Cyberknife is so precise. We don't have to worry about causing problems by delivering the radiation that quickly. But the great thing about Cyberknife is that it's 5 treatments, not 9 weeks.
Let's talk about COVID-19 just a bit. It's a constant concern for so many out there. What are some of the things that you are doing to ease those fears?
Our primary concern is keeping patients safe and healthy, and also our staff. And we're following all the public health guidelines, CDC guidelines for, cleanliness and hygiene. So it's all of those things. And it seems like we've been doing that forever now, but
right, you got it down.
Got it down at this point.
All right, so no reason, first of all, we want to let all the men out there know, no reason to ignore signs if you have them, but also just to pay attention to your health, as sometimes can be the biggest barrier there. So columbusck.com, you can check it out for more information. Dr. Widman, thank you.
Thank you very much, Robin. Appreciate it.
Always a huge help, I should say, to have someone to talk to while you are receiving cancer treatment, someone who knows exactly what you're going through. It's why Columbus Cyberknife created the Prostate Cancer Support Community. Now, this is an online group for those who have prostate cancer, have survived the disease, or even those who have loved ones going through the battle. You can join the group at facebook.com/groups/prostate cancer support community.